Assalamu alaikum. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Today we have a very important topic. The topic today is infectious diseases. Exactly what are they and how are they transmitted? And for this extra special episode and for this information, we are going to talk to Dr. Masab Umair, who is the in charge of the virology department of the National Institute of Health. So let's go and talk to him. Okay, and we're delighted to be here with Dr. Masab Umair, who is the Senior Scientific Officer and also in charge of the Virology Department for NIH. So thank you very much for taking out the time to see us today.
Thank you so much. Thank you for the invitation. I'm really grateful to Pakistan Television for inviting me. Thank you.
It's a pleasure to have you with us and on such an important subject. Something I think that is, many people are very confused when it comes to infectious disease and viruses and everything that's been going on, especially in the past when we had COVID. So this episode, I'm sure, will be a real eye-opener for our viewers. Okay, so if we started with this question, that what exactly are infectious diseases, and keeping in mind Pakistan's unique challenges in healthcare, how much of a health burden is it?
Yes, so infectious diseases, basically these are illnesses which are caused by pathogenic microorganisms. It could be bacteria, viruses, fungi or parasites. So they are basically, they transmit from one person to another, and they can be transmitted either consuming contaminated food, contaminated water. They can be transmitted through air and as well as through different vectors such as mosquitoes. Mm-hmm. So in the context of Pakistan, we all know, unfortunately, Pakistan is one of the 2 countries in the world that are endemic for polio. And the second one being Afghanistan. Apart from that, we have a high disease burden, the highest in fact disease burden of HCV, hepatitis C virus. Mm-hmm. And then we have several other infectious diseases common, like dengue. We almost every second year we have huge outbreaks of dengue in the country. Mm. Then we have Crimean Congo hemorrhagic fever, highly lethal disease.
Which is the Congo fever?
Yeah, Congo fever. But its hotspot is in Balochistan. Mm-hmm. And it's again bordering with 2 other Crimean Congo endemic countries, Afghanistan and Iran.
And that is a tick-borne disease?
Yeah, that's a tick-borne disease. Mm. It spreads through ticks or contact with infected animals. Okay. So apart from that, we have high disease burden of TB, malaria, and then acute diarrheal diseases. So it's unfortunate, but yes, Pakistan has all these diseases.
Right. Yeah. Okay, so if we talk about infectious and non-infectious disease, what's the difference there?
Yes, so as I mentioned, infectious diseases are those diseases that spread from one person to another. Mm-hmm. And that's the main difference between the infectious and non-infectious. So non-infectious, also called the non-communicable diseases, okay. They do not spread between people. Mm-hmm. and they are normally either due to genetic, physiological or environmental factors, mm-hmm. that contribute to the non-infectious diseases. So infectious diseases, they are caused by microorganisms, mm-hmm. and they can be spread from one person to another, and that's not the case in non-infectious diseases.
Okay, right. When we use the words infectious and contagious, are they the same thing or is it different?
Yeah, so when we say contagious, it's basically being highly transmissible, it can spread much more when through other person. That's why we call it contagious.
So as you mentioned, these infectious diseases and the huge burden they have on Pakistan, what is the method of approach in sort of like, number one, raising awareness, screening and actually treating these diseases?
Exactly. I think you mentioned all the three important things that should be available in any country to diagnose or control infectious disease. First of all, I think it's important to have a diagnostic network in the country. So there should be labs available that can diagnose different infectious diseases. That's very important. Then in their control, you need different control strategies, either through vaccination or through different public health measures you can control these diseases. And lastly, I think most important is the awareness among the population. So people, they should know how the infectious disease spread. So like different diseases spread through different ways. So it's important that people have awareness. So if you look at dengue, it spreads through mosquito. So avoiding bites of the mosquito can be a useful way of preventing the disease for dengue. However, if you look at COVID or other respiratory diseases, they basically spread through the respiratory route. So you need different measures to control that disease. And similarly, there are diseases that spread through blood-borne, through direct contact, or through water. Or so you need to. It's important that the population they have awareness of how these diseases spread and how they can be controlled.
So when we talk about dengue, as you mentioned, we did have quite a campaign of like spraying at the right time and using pesticides, and then telling people not to leave vessels which can collect water anywhere around their homes or something like that. How much of a difference did that make? Did we have lower figures from dengue patients, or is there still a lot of work to do?
Yes. Still, there is a lot of work to do, but if we compare it to previous year, we have much lower cases this year. But again, the dengue fever, it's mainly due to, as you mentioned, the stagnant water, or and mainly the outbreak. It's in the rainy season or monsoon or post-monsoon season. So here again, I think awareness among the population is important. They should be aware that there is no water standing in their nearby facilities in their home. They should use repellents to avoid mosquito bites. And at the government level, again, I think it's the whole vector management program that's the key to the control of the disease.
Okay. You also mentioned COVID. And that was a time in everybody's life worldwide that had, not just the physical repercussions, but also the psychological and the emotional, the mental, everything was going on. For a place like Pakistan, where again, infectious disease, and we didn't have the climate here where people would think that generally how flu is spread, not to visit each other's homes when you have a cold. These things we mainly experience in the West. In Pakistan, it's a bit of a different cultural scenario as well. What were the challenges here when we had the coronavirus, and how was the message spread? Because I think communication is key. We had a whole campaign which, in fact, if you look at it, it did quite well in spreading awareness and getting people to vaccinations. Tell us a bit about that, please.
Yes, so at the start of the pandemic, Pakistan, I think, faced the similar challenge that most other countries they faced, because we had limited diagnostic capacity. And if you can remember, in 2019, when the virus was first identified, it was called the novel coronavirus. So novel means something new. So at that time, the diagnostic facilities, they were a challenge for most countries. Fortunately, with the support of government, with our different partners, we managed to establish this facility within the country. So first step was to timely diagnose these patients, and then to obviously isolate. So that was very quickly done by Pakistan. And then immediately after that, once the vaccine became available, So vaccination campaigns were done, and this was basically at a mass level. So all the people, they were vaccinated, and I think that's one of the key thing in the control of the disease. And here I think I would like to mention the importance of our National Command and Operations Center. I think it played a central role in controlling the disease, because it was the platform where all the decisions regarding COVID, either it was vaccination, testing, or quarantine policies, they were taken at that level. So it was, again, I think, a combined effort where our government, different stakeholders, and the general public, they played a key role and that's why we are here, where we're in a much safer place as compared to other countries.
You also mentioned fungal infections. How common are they? Because we don't hear people talking about them. Is it something that's easily missed?
Yeah, actually fungal infections, they obviously they are not that much, they cannot be, you can say, transmitted like a viral infection, but they are common. Normally they cause skin infections that are quite evident. So we at NIH, we have a separate department that tests these patients, or that has this diagnostic facility. But again, I think I have to categorize. So the viral infection, they are the most infectious of these.
Okay, okay. Many times it so happens that you go to the doctor with maybe flu symptoms or cold symptoms, and the doctors say that, okay, you have a viral infection, this is viral, and then they give you antibiotics. So you're thinking, okay, the antibiotics are supposed to be working for bacteria, so why are we getting this for a viral infection? Could you please explain that for us?
Yes, I think first of all, the main thing here is to be diagnosed. When you go to a doctor, or you have fever or any other sign symptom, it's important that you are properly diagnosed. And that can be done through labs. We have labs in the country. But when a doctor says that you may have a viral infection, it means that it basically can affect your immunity.
Okay.
And your immune level will be low once you are infected. So if they prescribe antibiotics, that is to make sure that you do not get infected with other bacteria.
Okay.
So because your immune level is already low, so that's why they prescribe antibiotics.
So that's a preventive measure.
Preventive measure, yeah,
okay,
exactly.
okay. So to stop other conditions happening.
Yes,
okay,
exactly.
so that makes sense now.
Yeah.
Otherwise, a person thinks, what's going on. Okay. Now let's talk about, it's been the pink eye, the conjunctivitis. Is that the right?
Yes, exactly.
Yeah, conjunctivitis. That's been spreading around like crazy. So what are is this a certain time of the year? Is it a certain time that this comes more flourishes, this virus? What's going on here?
Yes, definitely. So conjunctivitis is basically spread through viruses. Mainly, we know that bacteria and allergy can cause conjunctivitis, but the current outbreak in Pakistan is due to a virus, and there are particular, there's a particular season where you see an outbreak of conjunctivitis, and it's basically related to the humidity in the air.
The monsoon.
Yes, you can say monsoon. Yeah.
Yeah.
So if you see in August and September, the humidity levels are quite high. And that's why and that basically gives an environment to the virus to replicate and to transfer from one person to another. That's why we saw the highest cases during these 2 months, August and September.
Right.
So this outbreak is due to a virus. In fact, we identified this virus at NIH, and we came to realize that this pink eye was due to a virus which is called as Coxsackie A24 virus.
Okay.
Yeah, so we identified it using basically high-level advanced sequencing technology.
Okay, right. Is it the same the whole world over? Does it mutate? Does it have different versions?
Yes. So virus, obviously, it can mutate. Once it multiplies, it has the tendency to change its genome. So it mutates. At the moment, this disease is also prevalent in our neighboring country, India, and in Vietnam as well. But we are not sure. Maybe it could be due to this virus, or maybe it could be some other virus. As I mentioned, this conjunctivitis is caused by many different viruses.
Right.
So we know what's the cause behind our outbreak, but it needs to be seen what virus is prevalent in other parts of the world.
So what was the treatment for this?
Actually, there is no as such treatment. Normally the infection, it resolves within 1 or 2 weeks. You don't need any treatment. Normally you can use cold water on the eyes, just to rinse your eyes with cold water. I think that is sufficient. There are some commercially available tear drops that can be used, but again, they should be used based on the prescription of doctor. So just to, I think the main thing is to how we can prevent the spread of this disease, which is quite contagious. So it's important that a person, he does not use belongings or things of an infected individual for his own use. So try avoiding using that. You should clean your hands. Hand hygiene is important. After touching fomites or surfaces which may be contaminated with the virus, it's important that you do not touch your eyes or your mucous membranes. So these are some of the very basic things that can help you keep away from this disease.
Right. You mentioned the humidity levels and the monsoon season. You know, we've just had the monsoon season, moving into autumn now. Why are viruses so rampant in monsoon? And it seems like, everyone's getting a stomach infection or something else, and everyone blames it on monsoon. Barsat ka mausam hai. So that's why everything is going haywire. Tell us a bit about what viruses do then.
Yeah, exactly. It also depends on not only the viruses, I think the way they are transmitted. A lot of mosquitoes, they thrive on these environments when there is water, stagnant water, or during the monsoon. So mosquitoes, they do carry these viruses. So when they get this opportunity to multiply, they use it. Then during monsoon, there is sometimes we have diarrheal diseases that are very common. Again, they spread through contamination of the water that can occur during monsoon. So
and then food rots very
yes, exactly.
quickly.
So that can also that is also one of the cause of this. But there are many other diseases that are not that are prevalent throughout the year. So, or maybe there are some diseases that are seasonal, like we have the seasonal influenza. COVID, you see cases throughout the year.
That's
so
right.
It depends on the environmental condition, as well as what's it in how the population is behaving. A lot of different factors are part of it.
Right. Okay. What when we talk about babies and the elderly and people with compromised immune systems, what infectious diseases should we look out for when you have a newborn baby, also elderly people in the house? How do we keep them safe?
This is quite relevant to our the current we have entered into the winter season. So influenza. There is one, or we normally call it the flu. So flu is one disease where people who are above 60, pregnant women, children who are under 5 years of age, and people who have chronic conditions, they are highly susceptible or vulnerable to this disease.
Right.
So since we are entering into that season, it's important that these people, they make sure that they get themselves vaccinated.
Okay.
Yeah.
And that's the yearly vaccination
yeah,
you're talking
yearly
about?
vaccine. So
Okay.
every year there's a new vaccine.
Right.
A vaccine is available in the market, in some of the pharmacies.
Is it too late to get that vaccination now?
No, it's just the start of the
Okay.
season.
So right now, if anybody is looking to get vaccinated against the flu, influenza, you can get that done now. We're not
Yeah.
too late.
Yeah.
So that's a bit of good news there. Okay. And children, they can get vaccinated too?
Yes, children above 6 months of age.
Above 6 months, they
Yeah.
can get vaccinated as well. So you can buy this from any pharmacy, or
Yeah.
do you have to have a prescription for this?
Definitely, you have to buy it having a prescription, but it's not available in all the pharmacies.
Okay.
So in certain pharmacies, the vaccine is available.
Right. Okay, that's good.
And just to highlight one more, you mentioned about children being infected by different diseases. So Pakistan is a country where diarrhea due to rotavirus, which is again a virus which causes diarrhea predominantly in children. So Pakistan is among the top 5 countries in the world where rotavirus gastroenteritis in children is the highest.
Oh dear.
So fortunately we have the vaccine available in our routine immunization plan. So every child is vaccinated. So we have that protection.
You have that under control.
Yeah.
That's great. That's great. Okay. Now, as you said yourself, that the winter season is approaching, and why is it when somebody says you catch a cold? You know, you've been outside and it's cold or whatever. You didn't wear a jacket or you weren't dressed properly. You come home and you start sneezing. How does that equate to catching a cold? I've always found this very interesting. I mean, the viruses are in the air and they jump on you when you're cold. What happens?
Yeah, I think it's mainly related to your immunity level.
Okay.
Once you go to a place where there is cold and you get the cold, so your immunity gets affected, and that provides an opportunity for these infectious pathogens to enter into your body, and the influenza, which basically spreads through respiratory route through the droplets. So I think that gives an opportunity for transmission to other person.
Okay, right. Please tell us about your work with the National Surveillance Laboratories of Pakistan, because I was reading up about what you were doing, and tell us how you're working with them.
Yeah. So we at National Institute of Health, we are the National Public Health Institute of the country. We are also the national reference lab for many infectious diseases. So whether it be polio or whether it be, in fact for polio we are the regional reference lab. So because we test samples from Afghanistan as well.
Okay.
So we have in Pakistan a network of public health labs. So there are 6 public health labs, 1 each in the 4 provinces and 1 in GB and AJK. And the 7th one is the National Institute of Health. So it's the National Reference Lab. So we have the provincial public health labs. So they are connected with each other. And for COVID, we also have a National Genomic Consortium. Basically, it involves 13 different institutions. It involves both the public health labs as well as the private sector labs. We have representation from academia as well. So during this pandemic, this consortium played a very key role in providing timely information on the circulation of variants of the virus that were prevalent in different parts of the country.
Right.
So, and the way it works is that these provincial public health labs, they are the first, you can say, the point of contact when there is a suspected case of any infectious disease. So the sample is sent to that provincial lab.
Okay.
They do the testing there and then they report to the relevant authorities. In case they do not have any diagnostic facility for advanced level diagnosis capacity, then they send samples to NIH, where we do process those samples accordingly, and then again we share the results back to the lab, to our health authorities. So this is how it works.
Okay, and I'm sure that is so beneficial in catching viruses earlier and being able to identify, because the main thing is to actually diagnose, and then you can go on from that. So that's really important work. Okay, something that is very interesting, next generation sequencing. Now that sounds so, wow, what's going on here?
Yeah, so next generation sequencing, if I put it in a simpler way.
Yeah, layman's term, definitely.
So it's a advanced version of sequencing technology, and basically it is used to get information on the genetic, it gives information about the genetics of organism.
Okay.
So using this technology, you can get information on either microorganisms, humans.
Mm-hmm.
So it provides information on the DNA or the RNA. And this information, again, it can be used in a number of ways.
Mm-hmm.
You mentioned about timely diagnosis.
Mm-hmm.
So NGS is involved in, has played a key role in that.
Mm-hmm.
We know that it was due to NGS that the novel coronavirus was first identified.
Mm-hmm.
So it was through next generation sequencing.
Okay.
And then how this virus evolved and how this virus spread to different parts of the country.
Mm-hmm.
This was again done through next generation sequencing.
Mm-hmm.
Apart from that, next generation sequencing is being used, the information that is generated through this technology is being used in either making diagnostic tools
Mm-hmm.
or in the development of vaccines.
Right.
So it is a broader application.
Okay. Okay. And how widely is it being used in Pakistan?
Yes, I will talk particularly about the infectious diseases and the use of NGS.
Mm.
So, at the start of the pandemic, there was very limited next generation sequencing facility available in the country.
Mm-hmm.
But as the pandemic it unfolded, we developed this facility at NIH and then in some of the provincial labs. So for COVID-19, we have been using NGS to track or monitor different variants of SARS-CoV-2. You have heard of Omicron, I'm sure.
Yes, yes.
So how when it was introduced into the country and how it spread to different parts of our country.
Mm-hmm.
So this was all tracked by NGS.
Mm-hmm.
And just to give you in numbers, so as far as this October is concerned, we have sequenced more than 7,000 samples of SARS-CoV-2 on NGS. So which is quite a good number, although it's not that big when we compare it to the regional countries.
Mm-hmm.
But considering the fact that this technology was not available before the pandemic,
Yeah.
I think still a lot of advancement has been done in this area.
Mm-hmm. Okay. So this genetic sequencing, can it be used in other illnesses as well?
Yes.
Like cancer,
Yes,
things
exactly.
like that?
Yeah, definitely. NGS, it has a huge role in non-communicable diseases, in cancer, in different genetic disorders that we see. But if I will, because I'm an infectious disease person, so I will again highlight how NGS has impacted Pakistan.
Mm.
So you can, one example is the conjunctivitis.
Mm.
We used next generation sequencing to identify the cause of this conjunctivitis in Pakistan.
Mm-hmm.
And it was through this technology that we identified that it is a viral pathogen, it is a virus, and it's a Coxsackie virus. Similarly, we have been using this technology to identify, to basically do the surveillance, genomic surveillance of different diseases, whether it be dengue, Congo. We also use this technology to sequence the Mpox virus. And interestingly, we came to realize that the first case in Pakistan was a co-infection of Mpox and the chickenpox virus or the varicella zoster virus.
Mm-hmm.
So this all can be done using this next generation sequencing technology.
Right. What about all the myths that take place with infectious disease? You're speaking of like the Mpox virus. I mean, that everybody was going crazy, hearing about that. Oh, this has come to Pakistan. Oh no, what's going to happen? What's this? What's that? So what happens communication-wise? What information is given to people? How is it dealt with? Do we have a vaccine here for Mpox, or what's going on? How many cases did we have?
Yes, so far in Pakistan we have reported 8 cases of Mpox.
Okay.
All of these were basically imported from other countries into in our country. Fortunately, there is no local transmission of this virus.
Okay.
And it's important to understand how this virus spreads. So this is not like COVID. So the disease is not spread through the way the COVID.
Or other,
it's
coughing.
mainly having direct contact, body to body, physical contact with an infected person. As far as Pakistan is concerned, there is no vaccine available in Pakistan. But again, I think it depends on the utilization of the vaccine. Since this vaccine, in fact, globally is available only to the high-risk group people who are at more risk of getting the virus infection.
Okay.
So it's mainly for those people. And if you see about the outbreak, basically started back in May 2022, last year in UK, and then it spread to some of the European countries.
Yeah.
So you can see the epicenter was those countries, and the other parts of the world, they have reported very few cases of this virus.
Okay. What would you say are the biggest challenges right now for infectious diseases in Pakistan that you're all working very hard to address?
I think first will be strengthening the surveillance system. That is very important. We need to strengthen our surveillance system for infectious diseases. We need to establish and strengthen our laboratories. Labs that are the crucial part, that are the basically I would say the central part in diagnosing a disease or play a key role in outbreaks especially. So we need to strengthen our national laboratory network. And then I think one key thing is here again is to make sure that there is awareness, public awareness, and there is proper communication from relevant authorities to the public. So as I mentioned, different viral diseases, they have different modes of transmission. And they have different, obviously, preventive measures can be taken toward them. So it's important that they are being properly and timely communicated to the population. And I think lastly, one of the challenges that I see is the sustainability, especially when I talk about next generation sequencing. So because, next generation sequencing is an expensive technology. And to sustain this technology, it's important that we have support from our health authorities, our health departments. They support the labs that are doing sequencing, and then we have support from our partners as well. And apart from that, it's important to sustain or retain the expertise that we have developed during the pandemic. Because next generation sequencing involves bioinformatic expertise. So the people who have these expertise, it's important that our system, they make sure that they are retained, so that we have a continuous surveillance of these diseases going on in the country.
So it's basically, if I put it in extra layman terms, it's telling you how a virus or disease is behaving and its past, which allows you to predict.
Exactly. I think you just said the exact line. So it basically tells you how a microorganism it's behaving. It's how it's evolving. What changes are in the microorganism, and that has direct impact on its control.
Okay.
So, on introducing an intervention like a vaccine, on maybe designing a better diagnostic tool. So all these things, they depend on the genetic information of a microorganism or any pathogen.
How can it help physicians?
Yeah, so for physicians, it's highly important that they know what organism or what's the cause of a disease. When we talk about, especially about infectious diseases. So NGS, it plays a very key role in timely identification of these pathogens. It can also provide very valuable information on, you can say that, on antimicrobial resistance. It can give information on whether a microorganism is having a particular change that can have an effect on resistance. So accordingly, a physician can devise a treatment strategy. So again, it's very important that this information is timely available to a physician, so he can treat the patient accordingly. Yeah.
Right, that's so true. As we're talking about infectious diseases and your area of expertise, one thing we find very common in Pakistan is that when people, feel that they've developed a fever or a cold or whatever, they'll phone somebody or ask somebody in the family, I'm experiencing these symptoms. And they will say, oh, okay, I took this antibiotic last week and I was better. So why don't you take that? Yeah. And then you will see, even whole members of the family taking antibiotics at will, at random, and sometimes also tell us about this not completing the course properly. We see that a lot too. Can you please tell us the dangers of doing this self-medication?
Yes. So first of all, I think I would say that self-medication is definitely not recommended. You should consult your doctor, and whatever is prescribed by your doctor, you should only take that. What's the disadvantage of self-medication? It's one of the main challenges that we are seeing globally is the antibiotic resistance that is being developed by use of these antibiotics.
Yeah.
And the more the bacteria or the microorganism will change, the more it is exposed to antibiotics, unnecessary antibiotics, it develops resistance, ability to evade that antibiotics. Okay. So it's important that we only use antibiotics that are being prescribed by the doctor. Otherwise, we can see maybe a pandemic coming in future.
That would be antibiotic resistant.
Yeah, and that could be a huge challenge.
That would be a horror story.
Yeah, exactly.
Yeah. So is there any guidelines? It's so hard to guide people when it comes to things like that. Is it because sometimes, honestly speaking, that there are some doctors who are very happy to prescribe antibiotics quite generously as well. So is there a rule of thumb or some sort of guidelines that a person can adhere to when it comes to taking antibiotics?
Yes, again, I think this mainly pertains to our regulatory system. So this has to be done at the top level, where the regulatory bodies, they make sure that all these antibiotics, they are being regulated, and similarly they are not easily available to anyone while in the pharmacy.
At least they should be on prescription only.
Absolutely.
Yeah.
So it's again a complex, it's a challenge, but our health authorities, they are aware of it, and they are working on this.
Okay, right. Any other, what would you say is a good way to develop immunity? A person, what should they be doing? Because our lifestyles, unfortunately, have just started revolving around sitting down, doing most of our work sitting down, and then really not thinking about meals as in healthy meals. We've got a lot of fast food, a lot of junk food, our children are doing this, and it's all become so ingrained in our daily life. Please shed some light to our viewers about how important it is for your immune system to be developed and how we can do that.
Yeah, so there are a number of ways. I would say that exercise, I think it's really important. It's highly relevant that everyone, they should dedicate or spend few minutes of their daily life doing exercise. So exercise is important.
And there's really no excuse, because if you can't go out for a walk, there's so many things you can find on YouTube or whatever, things a workout for home.
Exactly, yes. So you don't need a gym or a particular equipment to do exercise. You can, as you mentioned, you can do it in your home as well. So apart from exercise, it's important what we are eating. We make sure that we are eating the right food. So make sure that you have fruits, you have vegetables, then you have protein source of maybe a meat or chicken in your diet. You're consuming healthy, you're avoiding those fast food and all those things. These are important. And then to boost your immunity or to stay away from infectious disease, I think just following basic hand hygiene, good sanitation procedures, they play a key role. So we can just follow them, and they will help us protect us from these diseases.
Right. And if we can touch upon how the government is working to, boost the it's a war against, infectious diseases and the health issues that we have in general. Tell us about that, please.
Yes, so when we talk about infectious diseases, our government, both at the federal level as well as at the provincial level, they are playing a leading role, whether in terms of surveillance or building these diagnostic capacities. If you see at the start of the pandemic, we had very limited diagnostic facilities for COVID in the country. And within a few months, with the support of our government, we managed to establish more than 200 such facilities. So government has played a very key role, especially when we talk about genomic surveillance and sequencing. As I mentioned previously, it's an expensive technology. So at NIH, we have secured funds for genomic surveillance from the government, from our Ministry of Health. So I would say without the support of government, it's very difficult to do sequencing or genomic surveillance of any infectious disease. And in overall, it will be difficult to control a disease. So support from the government or the health authorities is very key.
Right. Dr. Masib Umair, in charge of the virology department of NIH, your work is so important, and it's been a pleasure to be able to sit down with you, and thank you so much for giving us the time and informing our viewers on things that are so important, because I think that's where we have another huge challenge, is when we talk about medicine and we talk about our own health. There's so many things that confuse us, so thank you so much for doing that for us.
Thank you for having me.
And just before you go, I'd like you to give a message to our viewers, just something that is easy for them to adapt and to take care of their health.
Yes, I think a message for the viewers will be, as we are entering into the winter season, so there will be cases of flu, so it's important that we make sure that we follow simple hand hygiene practices, we follow good sanitation practices, and we make sure that we avoid crowded areas. We avoid contact with people who have symptoms, who have fever. We make sure we do not make contact with them. And if we have fever, if we have developed fever, we make sure we contain ourselves within our home. We do not go in public and spread the virus or the disease. So and also because dengue is at the moment is prevalent in the country, so we make sure we take all the steps to avoid mosquito bites.
Yeah.
I think these are just the basic things that we can do to protect ourselves.
Thank you so much. Thank you so
Thank
much. And with that, we come to the end of today's program. See you next time. Until then, stay happy, stay healthy. Bye-bye.